And people ask me, do you like your job? And I tell them, it's not a job, it's a lifestyle. It is literally, it's a lifestyle. It's what I do every day, day in, day out. These patients need you really quickly. We talk about the golden hour in that, the patients who have undergone a severe trauma, how that first hour is really important for their survival. And that hour doesn't start when the patient arrives in the trauma bay. It actually starts when the patient got injured. And so you really want to be there and involved in their care as soon as you can. And hence, like when I moved back from South Carolina to Ottawa and decided to buy a house, my wife and I were always looking on Google and trying to kind of did a radius of 20-minute drive from the hospital, because I knew that I had to be there. And there's no choice. We saw a lovely house, beautiful houses, 25 minutes out, and that would mean that's an extra commute time. And you have to drive in the winter. It could be a snowstorm. There's no excuse. You have to be there at that time. Regularly, we'll get a phone call from my uncle before, for instance, COVID, or my cousins say, hey, we're having a gathering, come on over. And I'll be like, guys, you live too far, I can't come there. And literally, it would be an extra 5 minutes. And like, oh, it's just an extra 5 minutes. Like, it's the extra 5 minutes for you. It's someone's life at the other side. I don't even look at the time that it takes me to get there. I know I want to be there before the 20 minutes, not because of the 20 minutes is being documented, because that's when I could do something to hopefully help that person's life. It's not even, it's not a thought process. It just becomes second nature. You gotta just be there and in the trauma bay within that 20-minute time period, and hopefully before.